Well, I started as a family physician, graduating in 1992, I guess licensed in 1992, worked full-time for 5 years, really dug in and enjoyed that work. However, I ended up feeling like I was spitting into the wind, that I really wasn't getting to the core of people's health problems, and I didn't feel like prescribing medications was helping them. I look back, I didn't think this at the time, but as I look back, I was intuitive. I could see some things that I didn't understand about people, and it made it really hard for me to work. I'd be having two conversations in my head, the doctor who was trained from university, and then there was this intuitive person who was arguing with the doctor all the time. So I finally said, well, I want to have children. God, do you want me to be a physician or a mother? And I got the answer, mother. And I guess my vision for a future wellness center would require caregivers to have a certain level of healing and integration of their own humanity in order to really give care properly. So that's where I could sort of see yet again this system that we've built with all the most pure intentions of giving care, that maybe we lost our way a little bit. While I was in the hospital, I recognized how misunderstood I would be, and it was them and us, and they had all these rules, and there really was no way I was going to get out of it. I recognized how tight the system was to really not allow for this spiritual blossoming to be, encouraged by slamming you down with physical medications and not allowing physical touch even. Contact is so limited. There was just so many things in the system that were exactly the opposite of what I would think would be a good idea for someone having a spiritual crisis or a crisis of any kind. But there was this fear developed around psychiatry, which makes a lot of sense. The idea of even spirit and mediums, that there was a time when certainly the Christian church had ways of making us very afraid of the bad spirits, evil being maybe contagious. So that sure enough, the system, I watched One Flew Over the Cuckoo's Nest, 40-year-old movie, plus 40-year-old movie, and things have not changed in 40 years. So it goes to show, this system was made a long time ago. We know better now, and I hope we will do better soon. Well, when I came here, I did sort of wonder, would this inspire me enough to want to come to Brazil and train in this type of mediumship work? And I still don't have a clear answer on that. I do see value in the mediums, when I've seen what they do, and I've experienced myself some very strong experiences. They did some what they call passes, where they put their hands over your body, and the energy movement within me was absolutely easy to experience. It was a very big experience. So I think that's one advantage of coming on a trip like this, where I felt it myself. I know with 100% certainty that they have moved some energy in me. I don't fully understand what that will mean for my future or how it will implement my potential self-healing, ability to enable others to self-heal. My big dream is to enable others to self-heal, heal myself and enable others to self-heal. That I really recognized that there was these different energetic levels of all patients, and I thought to myself of even my own experience as a doctor, and I felt that the system had no way of trying to discern what level you were at. I think energy is the missing component in Western medicine. The concept of we all are conduits of energy, and we all vibrate and resonate in different ways, and it has an impact on our health and on our actions.